Hi guys, we're going to be doing a central line dressing change, and whenever we are getting started, we make sure we always verify our orders. We gather our supplies. For the checkoff, we need a central line dressing change kit, your sterile gloves if you need a personal size, or you can use one in the kit, a pair of regular gloves, and 2 masks, one for your patients and also one for yourself whenever you're going to be doing central line dressing changes. All right, so let's get started. We're walking into the patient's room. We're knocking. Hi, my name is Casey. I'm going to be your nurse today. I'm also providing hand hygiene at this time. Can I please get your name and date of birth? That's good and does match on your bracelet. I did get an order to change your central line dressing today. Have you had that done before?
No.
Okay, so the line that's in your chest is a central line. We've got to make sure that we're going to change the dressing, that it's going to be sterile. There's some things that I need you to do while I am doing this procedure. Can you turn your head to the side away from your line so you don't breathe on it? And also I'm going to have you wear a mask. Is that okay?
Okay.
Also, I need to ask you, do you have any allergies to latex, to any adhesives, or even antiseptics that I'm going to be using on you?
No.
Okay, so at this time, I'm going to go ahead and hand you your mask. I'm also have already provided privacy by closing the room door. And I've already lowered or raised the bed, put my patient in a working position, and also including safety. So what I'm going to do first is I'm going to go ahead and put my mask on as well. And as I can see, we've located the central line right here on the chest. It already has a dressing intact, so I need to get regular non-sterile gloves to remove the dressing. I've already done hand hygiene. The big thing about this when we are removing the dressing is making sure that we are doing an assessment on the insertion site to make sure there is no redness, drainage, swelling, anything that is concerning to us that we would report to the healthcare provider. Also, we do not want to touch the actual insertion site with non-sterile gloves because we do not want to introduce microorganisms to the patient. So we're going to start by working around the corner and working the old dressing up. Again, not touching the insertion site. So now I'm at the very end and I lift up the dressing. There we go. Our dressing is off. We will take our old gloves off and do hand hygiene. The site looks good. There's no redness, there's no drainage. Our patient has a mask on and their head is turned to the opposite side. Now we have our central line dressing kit that make sure that we have. And also I wear size 7 gloves. I do not use the gloves that are inside of my sterile kit. So when we're opening sterile kits, we want to make sure that we are opening away from us. So here's the tab. I'm going to open away. And remember, when you're creating a sterile field, that 1-inch border along our tray is considered our dirty contamination. All right. We also do not want to turn our backs on sterile fields. We also want to make sure that we are very cautious. If we do break sterile technique, we need to make sure that we call it and know that if I do break sterile technique, I'm going to start over. I'm going to reach in and grab the sterile gloves, which I'm not using. I'm replacing my own with my size 7. I'm going to open, making sure I'm not overlapping my sterile fields. I am right-handed, so I'm going to do the pinch and scoop method with my left hand, picking it up, stepping away, and putting on my sterile glove. Now I'm going to do the scoop method on my other hand. Can you see it? Again, stepping away. Okay, we good?
Yeah.
All right, sterile gloves are on. Now we can go. Do not worry about trash. That's what gets people. All right, we're going to go and get our applicator. This is our ChlorPrep. We're going to activate it. You're going to squeeze the wings, and you're going to hear a pop, just like that. And the solution, the chlorhexidine, is going to go to the pad on top. This is going to go straight to the insertion site. We're going to kind of agitate it, rub it, and then we're going to go in circular motions. All right? Always working from the center out. Never go from dirty to clean. You can drop that. We don't need that anymore. We don't need a mask. We don't need that. We don't need a Q-tip. We do have my alcohol swabs. Ugh. I'm going to clean the single lumen all the way down. Get another one, and you can clean the other side. Okay? Do not go from dirty to clean. You've got to go one swipe down. Clean to dirty. All right. We're going to let that dry. And then we have the protective wipe. We will use this on a real patient, but on our mannequins, they become very, very sticky. So what you're going to do, you're going to open this. Then you're going to go around the barrier. Do not put this on the insertion site. All right, our last thing we're going to put on is our Tegaderm. When you peel it off, make sure you do not touch the sticky side of the Tegaderm. And you're going to go right on the middle and put the insertion site right in the middle, just like that. Now we get it down, and now our gloves kind of turn to regular gloves. We're non-sterile now. What we have covered now is sterile, our insertion site. So now we're going to peel away. We're going to try to peel away this tag. Again, we're talking to our patient the whole time, making sure they're okay. Oh, this tape is not going to come off very good. As I struggle with the Tegaderm. I'm okay because whatever is covered is covered. I'm okay with it. We're just doing regular gloves now. As you can see, that might stay on there, but it's covered. And we're going to take the little sticker because we always got to time, date, and initial it. I don't have my pen. So time, date, and initial, and making sure when we put on this sticker that we don't put it over the insertion site. We put it to the side. There you go. And that is it. And then you're going to do your finishing skills. Lower your patient back down. Safety concerns, call light always within reach. And then also, you're going to document. You need to contact the doctor if you have any concerns in regards to when you are changing your dressing or you observe, signs of, any type of infection. And that should be it.